So now we're going to be talking about diseases of the eyelid, and this is going to be part 3 of my ophthalmology series. Now, diseases of the eyelid, today I'm going to be covering chalazion and hordeolum or stye. So hordeolum is the same thing as a stye, but a chalazion is different. So let's go right into it. But before we go into it, I want you to recall what was the purpose of the tarsal plate. So if this here was the eyelid that I've drawn. Inside the eyelid, you could see the tarsal plate, which is this rigid supportive structure here. Within the tarsal plate, we had glands. Those glands specifically, what were they called? They were called meibomian glands. And what happens when there's some kind of obstruction? What happens to those glandular secretions? Well, the glandular secretions start to accumulate in here. And as those glandular secretions accumulate, that is what leads to inflammation. And remember, so when inflammation occurs, there is that is what leads to the diseases of the eyelid, and that is what leads to things like chalazion and hordeolum. Okay, so let's start with this. So do you understand the mechanism behind it? That there was a tarsal plate, which was our supportive structure within the eyelid. Within that there were glands. The glands were known as meibomian glands. Those glands were responsible for secreting the lipid/oil layer that envelops our tears. Okay, and as those were responsible for secreting that, if there's any kind of obstruction over here, that would cause accumulation of those secretions. Now let's continue. A chalazion is typically arises due to a meibomian gland obstruction. Okay, typically due to a meibomian gland obstruction, and it can be defined as this swelling that we see in this picture on the right here. Look, this swelling, this really outstanding voluminous kind of swelling, and it's due to this chronic lipogranulomatous inflammation of the meibomian glands. Okay, but interestingly, it still presents as painless. So for us as doctors, this is a painless upper eyelid swelling. And why do you think it's more common on the upper eyelid? Well, it's more common on the upper eyelid because the meibomian glands are more numerous on the upper eyelid here. Okay, so if you look at the image on the right, you can see a chalazion. How do you know it's a chalazion? Because it's on the upper eyelid. And remember that we do get a different type of chalazion known as a marginal chalazion, and those arise on the margins of the eyelids. Now the treatment for this chalazion would be our intralesional steroid injection, followed by incision and curettage. So that is what a chalazion is. You can see it over here. I've drawn on top of this picture to demonstrate how this is an injection that is going straight into the lesion itself, going straight into the swelling itself. Remember, you can start off with conservative treatment with warm compressions, because at home, what are you going to ask the patient to do? Warm compressions, because it may just dissolve by itself, and topical steroids. Excuse me. So but if it's more severe, you can take an intralesional steroid injection, which goes directly into the lesion. Now, an important thing, what do you think is happening to this patient when he has a swelling on the upper eyelid? That is actually going to cause drooping. So what will we see? We will see ptosis or drooping of the eye. So that was our chalazion. Now I want to talk to you about a hordeolum. A hordeolum can be either external or internal, and these both present differently. With the external hordeolum, it's acute suppurative inflammation, which is often painful. So here, look, I have written painful lid swelling, and it's typically caused by infectious agent Staphylococcus aureus. Okay, And this one is maximum at the base of the lash follicle. So it presents slightly differently to the chalazion. Well, very differently. Remember the chalazion, what was the chalazion? Was it painless or painful? It was typically painless. But here our external hordeolum is painful. And so is our internal hordeolum. Now I've just remember that while the chalazion was due to a meibomian gland obstruction, now we're outside the tarsal plate. We're talking about the glands over here, and those glands are glands of Zeiss or Moll. Glands of Zeiss or Moll. So that's why I like to picture Zeus, because it sounds like Zeiss. And Zeus is carrying his lightning staff, and that should remind you that the external hordeolum is which affects Zeus, or the glands of Zeiss and Moll. They are caused by Staphylococcus aureus. Zeiss, it's due to a dysfunction of the Zeiss glands. And remember, he's got this shield, and he's holding this shield right at its base, and that should remind you that the maximum is at the base of the lash follicle. Next, we have the internal hordeolum. The internal hordeolum is actually due to, again, meibomian gland dysfunction. So I want you not to forget what other eyelid disease or eyelid swelling, eyelid inflammation have we already talked about that was due to a meibomian gland dysfunction. Chalazion, you're right. So chalazion was also due to a meibomian gland dysfunction. So is internal hordeolum. And I like to say meibomian. So stress the I, so you will remember that the internal hordeolum is caused by meibomian. Alternatively, you can picture the tarsal plate and remember that the meibomian glands were in fact located around here, whereas Zeiss and Moll were located farther away. The internal hordeolum is also caused by Staph aureus, and it's also a painful lid swelling. I have some notes over here just to simplify this concept further, that the hordeolum is a swelling in the eye. It's also known as a stye. So don't forget that hordeolum and stye are the same thing. It's that kind of smallish swelling on the eyelid. It's very common. It can occur even due to bad or inadequate eye hygiene. So your external hordeolum, as we talked about, was due to glands of Zeiss and Moll, and your internal hordeolum was due to meibomian. But remember, it's still Staph aureus, which can cause or lead to the infective agent for both. And remember, was chalazion due to some kind of infective cause? Was chalazion infective? No, chalazion was simply because of an obstruction to the meibomian glands, okay? It was not due to an infective agent, whereas these hordeolums or styes are due to infective agents, Staph aureus. Remember the internal hordeolum, you have to remember that here are your meibomian glands lining the eyelid, and because that opening of the meibomian glands can be dysfunctional, when the doctor presses on that eyelid, there may be pus that's secreted upon pressing of the eyelid, okay? Whereas over here, this would be the eyelid, here would be the swelling, and in external hordeolum, and in both actually, it would be rather painful and tender, the eyelid, and it would be red and edematous, and typically chalazions are chronic. So don't forget that as well. Chalazions are typically chronic, whereas hordeolums are typically acute because they're caused by staph, aren't they? Typically it's due to an infection caused by staph. So those are the differences and those are the similarities between the two types of hordeolums. And you have to remember that treatment for the hordeolums can be analgesia, so pain relief. It can be hot compression, warm compression again. You also want to give local antibiotics plus systemic antibiotics plus anti-inflammatories, drugs. And just finally, to really hit home the differences that we can distinguish between chalazion and external hordeolum. Chalazion's typically on the upper eyelid. it typically has no pus and no pain, and it's painless. Whereas external hordeolum, look here, it's kind of filled with pus. That's why it appears almost whitish. And also chalazions due to the meibomian gland dysfunctions. Meibomian glands, what were they responsible for? Meibomian glands were responsible for secreting that lipid oil. I mentioned it at the start. Secreting that oil lipid layer which covers our tears. Then the hordeolum is most commonly found near or at the base of an eyelash follicle. Remember I talked about Zeus or Zeiss for external hordeolum. And it's due to a bacterial infection at the eyelash follicle or in the oil glands. If it's at the eyelash follicle, it's more likely to be external hordeolum. If it's at the oil glands, we know that's talking about meibomian with an M-I. Tenderness and swelling is common, whereas here this is a firm, painless lump. Here you might get spontaneous drainage and warm compressions, whereas chalazion, it might progress to a more severe kind of treatment, which is an intralesional steroid injection. I hope you enjoyed this video, and please give it a like, and I will be making more and more ophthalmology videos, so stay tuned, and please give it a like as well to help me out. Thank you so much.